If I had to describe the anesthesia residency here at Beth Israel Deaconess, I always describe it as world-class training with a hometown feel.
We are a very strong program. We not only focus on our residents and trainees, we focus on our faculty as much.
I'm Mike Herring, I'm Vice Chair of Clinical Affairs. We do about 100,000 operations per year, procedures a year in this department. I work clinically at least 4 days a week, and probably the majority of that time I'm working with residents.
We have highly talented faculty that come from all over the world that are experts in their field, but what they all have in common is that anesthesiology is their first passion and their first love.
I came here mostly because I wanted to come to BI to train for critical care, and that was because this program is very education focused.
I think the strength is the resources that it provides, whether it's collaboration with top researchers, collaboration with other physicians who are advancing their specialty. I think within that environment, Beth Israel has always been really innovative. We're always trying to push the envelope a little bit. We don't take anything for granted, and so that kind of pushes us to do more and try to be better, and keeps us really open-minded and willing to try new things.
We are looking at an applicant that is academically very strong, is well-rounded both inside the medicine and outside the medicine, have shown a track record of being resilient and goal-oriented with some achievements in their area of interest.
Humble enough to know that you don't know everything, and driven enough to kind of follow through to make sure you work on the things that you need to work through.
I think what defines our community is someone who's intellectually curious and very collaborative, and not only passionate about medicine, but also here with a very positive attitude and is excited to learn and care safely for patients.
I think when you start off in anesthesia, it can be very daunting. It feels sort of like you're being thrown into a pool and you're suddenly doing these really difficult cases by yourself. And it's hard to measure the improvement that you're making or the education day by day. But when I look at what I've learned in the last year, it's amazing to me the amount of things that I now feel comfortable with.
I just finished my cardiac months and was able to do over 10 pump cases. We got to do central lines, arterial lines, and learn like the foundational elements of cardiac anesthesiology and TEE then, and I was very happy to be a part of that.
Clinically, every single type of surgery we do here, we have great ICU training here. We have a great cardiac program.
There's a lot of dedication to education and their learning. In fact, they're out of the OR 1 day a week on Tuesdays. We call it TED Tuesdays, when they're exempt from their clinical responsibilities, and they just have lectures and learning opportunities during that day.
At Beth Israel, I've seen absolutely everything. Feel very, very comfortable with big cases, with sick patients. So I came here for the clinical training, and it's exceeded my expectations.
This department has great leadership, I think, from the very top all the way down. It's what's made our department so strong.
I've been really impressed and pleasantly surprised by how supportive the faculty here have been. They really do pour into us, and they strive every day to make the program a more cohesive, more supportive place for us.
I work with residents almost every day, and it's very enjoyable for me, having come back here from private practice, to be able to interact with these very accomplished, bright young people on a daily basis as they learn to care for patients in our operating rooms.
For any resident, if they're interested, our department is very open and very supportive to different types of research ideas and projects.
Our global health program is really one of our strengths here. We have a group of clinicians led by Dr. Katrina Stewart in Botswana, and they head up our global health program, and our residents participate in a global health research track.
Every resident's lucky to rotate for 3 months or more at Boston Children's just down the street. We get great autonomy there and learn the bread and butter pediatric cases to support our careers.
I get plenty of experience in very, very difficult cases that I think will prepare me for a career where I am very competent and strong in my field.
I think the residents are extremely well prepared to go out and do whatever they want to do. And in fact, they can tailor their training to what they want to do.
I absolutely love the residency classes. They are full of so many vibrant and diverse people. They come from so many different walks of life, and they just love being around each other. That's the first thing that stuck out to me when I was interviewing for my residency programs. I could just sense the strong community amongst them and how much they love to have fun with each other.
We go to sim labs together to practice skills that may be one person's strength but another person's area of improvement. So it's just like really looking out for yourself and for others around you, because when you grow together, then you're going to grow more than if you were just doing it on your own.
I love the New England area, but Boston, it's where you want to come for some of the best training in the world, so I think Boston was a big call for me.
I could use my second language, Haitian Creole, in a clinical setting. The combination of Boston being so renowned for education and medical training, and then also having that sort of cultural piece really excited me, so that's why I came here.
And Boston's also a great city where we have great co-residents to hang out with outside the hospital as well. Being a big city, we have big sporting events. We also have every major concert that kind of comes through here. So it's a great outdoors area as well.
I'm really proud of the fact that whatever the residents want to do ultimately, they come out of this program extremely well prepared to do that.
This place has prepared me for everything, everywhere.
If I had to go back in time and decide if I were to come back here at BI and decide to match here, I would 100% do it again.
That's why I came all the way across the country for a brand and for a recognition, and for a great training program such as Beth Israel.
Our residency program and our fellowship program, they are the best in the country.